Hey everyone, what are three questions that you should ask when investing into the psychedelic space? Anthony Tennyson, CEO of Awakn Life Sciences, outlines these three questions and why Awakn checks off every single box. What are they? Find out in our latest podcast. Hey everyone, welcome to the Dales Report. And today on our podcast, happy to be joined once again with the CEO of Awakn Life Sciences, Anthony Tennyson. Big smiles. How are you, brother? You staying warm?
No, I am very cold here in Ireland this evening. We've got a red storm warning across pretty much the whole country. So 150-kilometer-an-hour winds. There's
Wow.
a hint of snow and sleet. So yeah, we're all kind of wrapped up, and that's why, like you, I'm wearing a hoodie underneath my jacket because it's freezing
Canada's
here.
Canada's not much different. Doesn't Miami feel like I know it was only about 6 weeks ago, but it feels like 6 years now, doesn't it?
It does. I would like to be back on the boat where you
Yeah,
interviewed me 6 weeks ago right
100%.
now.
Before we get into all kinds of stuff, what'd you think of the event? What was your big takeaway?
Key takeaways from Miami. One, it was wonderful to get to meet people in person.
Yep,
It was just fantastic because we're herd animals, Shad, and we like to spend time with each other. And it was good to get
100%.
away from screens and actually to see real people in 3D. Second thing was it was great to just see the energy and the enthusiasm around an industry, a young, early stage industry, but everyone is committed
Yeah.
to trying to help people as quickly and as efficiently as possible. And that's the great thing about the psychedelics industry is it is a health and biotech industry focused on solving some of the biggest problems that face society today in addiction and mental health. And it was great to meet so many like-minded individuals who are so interested in achieving that end goal. And then
Anthony, where do
I
you
get
see? Oh, sorry. Go
no,
ahead.
no, no, no,
Continue.
no, go
I
ahead,
wanted
go
to
ahead.
ask, like, and that sounds great and everything, but as we know, markets have been taking a little bit of a hit in the industry, to say the least, since Miami. I think there was some encouraging news, or like, some certain echelons or thresholds that the industry wanted to meet, obviously with Compass and their results, and those kind of they were okay. I think people were hoping for a little bit better, but regardless of all that noise and what's going on, when I ask about your takeaway, where do you see, because from what I've heard when I was down there, this industry is going to move fast, and that's promising, especially for people looking to get involved from an investment standpoint. But even outside of that, even for people to obviously have alternative medicines, insurance companies talking about possibly having a psychedelics division within the next 2 to 3 years. Was that some of the stuff that you heard? And just to kind of give like a forecast as to what you're expecting this industry to grow, where do you see this going?
So where do I see the industry going in the next couple of years? Well, from our perspective, we're a medical biotechnology company, and we're focused on driving research to
Right.
secure marketing authorization and therefore on-label use and reimbursement for the medicines and the therapeutics packages that we're in the process of developing. So to me, where I hope to see this industry going is fully integrated into the existing addiction treatment industry for us and the existing mental health treatment industry for other firms that are or other companies that are
Yeah.
focused on that. And to me, you've hit the nail on the head, right? For this side of the water, that means support from and engagement with the public healthcare system in the primary instance and the healthcare insurance companies in the secondary instance because of the pervasiveness of the public healthcare system in Ireland, UK, and Europe. And then in the US, it's absolutely got to be support
Right.
and engagement with the insurance companies. That's where I hope this is going to go, and that's where I believe it absolutely has to go for us and other companies like us to achieve our goal, which is democratization of psychedelics. And democratization of psychedelics is it's got to be available to the masses and not to the select few. So that's where I view this going, and I think we are, yes, there's been some selling, right? And there's been some selling. It's probably people trying to, for tax purposes, they're trying to they're
Yeah, I
trying to
know.
cash in
You
certain
guys have
positions.
stayed strong though. You've maintained a lot, especially there's a lot of companies that are down, but you've actually, when I look at your, for investors looking for any psychedelic company or stock in the industry, you perform really well.
Yeah, we're up from where we went public. We're one of the better performing companies in the industry since Labor Day. Yeah, we and everyone had a bad day on Friday of last week. We're up from where we were on Friday last week. I think some people are still tracking down. I think again, I don't think that's an indictment of any individual company. I think it's just people trying to capture losses. so that they can offset them against their trading
Yep.
portfolio gains for the year. I do think we are really going to see this industry take off as we get into next year. People are clearing the decks, preparing themselves to get going in a meaningful way. When I talk about this, I'm talking about institutional investors are preparing themselves to come in behind this industry, I believe, in a relatively material way next year. And I think that's really what separates this industry from other emerging industries or industries that have emerged in the last couple of years, is this is an industry that is ripe for investment by institutional investors in addition
Yes.
to retail investors. If you look at
Yeah, I've heard that too.
the cannabis industry never really got the institutional investors behind it in a meaningful way, whereas this is the health medical cannabis industry never got the biotech investors behind it in a meaningful way, whereas this industry is fundamentally different. Companies like us and others are investing in preclinical research, in clinical stage research, in order to solve those big problems. And that, I believe, should make us attractive to the biotech investors once they've cleared the decks at the end
I
of this year
100%.
and,
I think it's
and
just
get ready to go in January.
it's plain and simple. The data and efficacies that it's producing, it's the biggest difference between cannabis, and that's why institutions are so very interested. And that's kind of the feedback that I got too in Miami. Even since then, some of the people I've spoken to in Toronto, they're looking for this to be very encouraging the industry, even as soon as January. So to your point with the tax law selling season, that makes sense. I know we had you on briefly a couple weeks ago, and I wanted to ask a little bit about this partnership. You signed a memorandum of understanding with the Devon Partnership NHS Trust and University of Exeter, that is a game changer for your company. So first off, for my viewers to understand, why is this a game changer and the significance of the NHS for people to understand a little bit better about who they are?
Absolutely. So just to refresh your viewers' memories, so Awakn Life Sciences, we're a biotechnology company, but we also have clinical operations. So we are developing and delivering next generation therapeutics to treat addiction. And so therapeutics, that means drugs and therapies used in combination. So we're active in preclinical, we're developing our own drugs, but we're active also in clinical stage research, working with ketamine and MDMA in phase 2A and phase 2B.
Right.
What we've done in Awakn is we've acquired the IP from the world's only clinical trial for ketamine-assisted therapy to treat alcohol use disorder. That trial was designed by the University of Exeter and led by the University of Exeter at the request of the NHS. And that results of that trial will be published in the American Journal of Psychiatry later on this month.
That's
the results
exciting.
of that will prove to be quite groundbreaking when published. And that kind of then
Wow.
drove the discussions with the NHS. So we've signed a memorandum of understanding with a part of the NHS in the UK. The NHS has got the second largest budget of any healthcare system on the planet. At about $200 billion per annum is their budget. They recognise that alcohol use disorder is a significant cost to them. Treatment rates are low, success rates are low. So you've typically got about a 75% failure rate for all treatments for alcohol use disorder in the UK. It's just not good enough. So the NHS knows that ketamine-assisted therapy has the ability to be more effective. And so what we've done is we've signed a memorandum of understanding with the University of Exeter, which is one of the leading institutes in the UK focused on psychedelics, and the NHS to bring that clinical trial forward from a phase 2B into a pivotal phase 3. The team in the University of Exeter are working with the UK state to secure co-funding. So we'll co-fund it along with the University of Exeter. But the trial, if we are successful, will be run in NHS infrastructure. Now that's really important.
That's encouraging. That's very
Because
exciting.
you've got a trial, the phase 2B, that was designed at the request of the NHS, and you've now got the NHS who are interested in collaborating with the execution of the phase 3 trial, which should then hopefully set us up to be in partnership with the biggest purchaser of healthcare services in the UK if and when we secure marketing authorization for ketamine to treat alcohol use disorder.
Wow.
So that's the plan.
That's
And that's quite
that's
quite,
great
quite
forward thinking.
yeah, it's really good. The other thing about it is we've actually, one of the other projects in scope is to compare and contrast cost and efficacy for treating treatment-resistant depression and alcohol use disorder with ketamine in our clinics versus treatment as usual in the NHS. And again, this is all about building the sort of the real-world body of evidence in addition to the clinical trial body of evidence, to enable us to win over any hearts and minds or debates or people who review the RFPs within the NHS, so that we can really establish a close working relationship with them in due course and really work with them in a collaborative manner to help as many people as possible in the UK.
Very encouraging. So if you anticipate positive results from this trial, what can you expect come January as to how things will move?
We are awaiting a publication date from the American Journal of Psychiatry. They have confirmed it has been accepted for publication, so we're just going through the admin side to get a publication date. When published, the results we believe will be quite good. We would hope to then use that to springboard forward from the phase 2B into phase 3, starting that project early next year. We've got a ketamine for gambling disorder study underway as well that we'll be looking to progress. So we'd hope that would make us, would evidence to investors that we are quite an attractive proposition. We've acquired assets in phase 2B for ketamine. We've acquired assets from Imperial College in phase 2A for MDMA, and we're active in preclinical stage research in our drug discovery program in partnership with Evotech, one of the world's largest drug discovery companies. There are not many other companies in the psychedelics industry that have assets in phase 2B, in phase 2A, and in preclinical. In fact, you're kind of looking at some very, very big ticket companies that are in phase 2B and phase 3. Really, that's MAPS and Compass. MAPS aren't publicly traded. Compass are valued at a significant amount. So we'd hope that would signal to the markets that we are quite an attractive investment opportunity with some reasonable upside potential.
It's great stuff. I got to ask, as when putting all this all together, there's some valid points that you're pointing out. And, you're considered one of the leaders within this space as far as CEOs. What are 2 or 3 important questions that you would ask if you were an investor walking into this space? Because everything I'm hearing right now checks off a lot of those boxes.
So 2 or 3 questions, or maybe 1 or 2 questions in the interest of time, that I'd ask if I was an investor. Who was it that said it's about the economy, stupid? It's about the data, stupid, right?
Right.
You've got to have data, right?
Yes.
You've got to have a validated data in clinical trials that have been validated by a reputable, competent authority. So we like to believe that we have that, having got assets in phase 2B and phase 2A in clinical trials validated by the MHRA. I think then what you've got to, if from an investor's perspective, is you got to look at the team and the advisors that the company has, and do they actually understand the industry? Do they understand the sector? And do they know how to bring things to market? And when you look at our team, I would like to think that we have one of the better teams in that regard, with Professor David Nutt as our Chief Research Officer, who has 40 years experience, and he's actually driving our entire thesis around how to use psychedelic assisted therapy to treat addiction. And the approach that we're taking, driven by David, gives us the ability to focus on both behavioral and substance addictions, which affect anywhere up to north of 30% of the adult population globally.
Mm-hmm.
We've also got Dr. Sean McNulty as our Chief Scientific Officer, who's got 20 years experience across preclinical and clinical stage research and experience of bringing blockbuster drugs to market. And we've got other team members in our management, but also in our advisory team. And in fact, it was just press release the other day, we're bringing in a new CFO who comes directly out of biotech, having worked in Gilead and Vectura as well. So really, we've got the best management team who have experience, like David, deep understanding of the sector, Sean, deep understanding of how to bring things to market, and now we're bringing in, beefing up the biotech side of our business. We've got an absolute rock solid data set that proves that what we're doing actually is efficacious and is potentially more efficient. And we'd like to think that that's a pretty compelling proposition for investors.
It's great. I love the story. I will say that. It's incredible, obviously, with what you guys continue to build out. Most importantly, obviously, providing alternative medicines for a lot of people. Last thing I wanted to ask you, when I look at all this stuff and this story that you're putting together and the people that are involved, the institutions you're speaking with, pharma companies as well, What's the overall consensus as far as like the receptiveness of the speak of like ketamine therapy over in the UK and in Europe? Like, is it gaining? It has to be obviously gaining a ton of attention and interest based on the efficacies that it is producing so far, correct?
Yeah, that's a great question. Sometimes you can. I was on a panel yesterday actually with Kelsey from Mindcure, and she said,
Yeah.
we all know what we're talking about because we're all involved in this bubble, but actually, how is it perceived externally? So all I can say is the willingness that the National Healthcare Service in the UK had with signing a memorandum of understanding with us, the engagement that
Right.
we've had from them in the design of a potential phase 3 pivotal trial has been significant, and that's the establishment.
Mm-hmm.
We as part of the business development process for our clinics business, we have over 600 people on our waiting list for our clinic in Bristol. We had a lunch and
Six
learn for the
hundred.
best way. Yeah, yeah, yeah. We had a lunch and learn for private GPs in London for the clinic that we're going to open up in London. We had 120 private practice GPs from Knightsbridge, Kensington, etc. turn up for a lunch and learn. So we've got really good traction in the UK at a sort of policy level, but also at an on the grounds level with clients, but also with GPs. And then we acquired a clinic in Oslo a couple of months ago. And again, the clinic that we've acquired there, what many people don't know is in Norway, the guy who works for us now as part of the clinic, he was actually delivering ketamine-assisted therapy for addiction and treatment-resistant depression in hospitals in
Really?
Norway as part of the public
Really?
healthcare system, in addition to the private clinic he ran that we acquired. So I think there's not broad acceptance. Sorry, there is emerging acceptance at a policy and execution level
Wow.
in the UK and EU. But the great thing is, it's really, really very early stages. So there's a significant commercial
That's
opportunity for companies like us focusing into the UK and EU. There's the barriers to entry for clinics are significantly higher than they are in the US or I believe in Canada. So that works well to us because we're now quite well versed in how
yeah.
to open these clinics.
Yeah. That's the key, managing expectations with investors this day and age, because in a time where we want things 2 minutes ago, we are still very much in the early stages of this industry. But most importantly, outside of just the investment side, these are encouraging times for people, obviously, based on the model that you're building out. But I appreciate the update. If I don't get a chance to see you again before the holidays, happy holidays to you and your family. And we will see you up and running come 2022.
Thank you very much. Great to speak to you and to your audience. And same thing, happy holidays to everyone who's listening. Thank you very much.
Thanks, Anthony.